Hello, my name is Lorraine Creech. I'm Head of Nursing at Mesothelioma UK. Today, we're going to have a chat to Sam Westbrook, who is our peritoneal mesothelioma nurse based at Basingstoke. These interviews are additions to our Facebook chats, and we hope you find them interesting. Sam, it's great to talk to you today, and I know we're keeping in touch over WhatsApp and telephones, but meetings have been cancelled, so it's great to see you and have a chat with you, even if it is just on screen.
Hi, Lorraine.
Hi. Is it okay for me to ask you a couple of questions?
Yeah, of course.
Fine. I'm immensely proud to be a nurse at the moment, and really immensely proud of all our NHS workers, particularly those who are on the front line. And you have really been on the front line, haven't you? You've moved back into an area of work which I believe you did some time ago when you were an ITU nurse. Can you just tell us a little bit about how that's been during COVID-19?
Yeah, so I've been back in my intensive care nursing role for about 4 weeks now. I'm doing a few shifts a week there and trying to run the peritoneal mesothelioma role as well, a couple of days a week. It's tough, it's hard not to think about what I've seen, it's hard to switch off. We're working under conditions that we've never worked or experienced in before. But like you said, Lorraine, it's almost a bit of a pleasure to be a nurse at this time, to be able to offer all our skills to these patients who are going through a very difficult time.
I think we can all feel the amount of effort and caring and nurturing that, alongside all the expertise that you're putting into this, and we're really with you and behind you in any way we can be, really. How have you coped with the pressure and the anxieties of being back in ITU during this difficult time?
Well, I think nothing could have really prepared us for this and what we're currently experiencing. I'm very fortunate to have a supportive husband and a family at home. I've now got new work colleagues in the intensive care who are very helpful and supportive of me, having returned there after many years and not knowing perhaps the environment or how certain things are being done. We've got psychologists as well who are looking after us, and my Meso UK colleagues as well, who are always in contact with each other, looking out for each other and supporting each other as we always do.
That's fabulous. Looking on from the news and what we're seeing and reading, people's roles seem to have really intertwined, probably more so than ever before. That's what we're picking up. Is that actually what's happening?
Yeah, absolutely. I think being a nurse or working in the medical profession has really key attributes, and being caring and compassionate for people, working as a team, communicating well, all those skills can be transferred to any area of the nursing profession that we find ourselves in. Particularly in the line of cancer care that we're working in now, we can relate that communication and how we talk to patients or their relatives on the phone, and they really do cross those areas.
Mm-hmm. I think the other thing that we're picking up is that, you know, doctors' roles aren't quite the same, nurses' roles aren't quite the same as they were historically, and that you're all working together, aren't you? And a blending of those roles in some ways.
Yeah, absolutely. The doctors have been really supportive and are understanding that we're in PPE, full PPE for many hours, and they come in and let us go off for our breaks when they're reviewing the patients. And likewise the other way, when we've been slightly short of nursing staff because they're off unwell, the doctors are stepping into those nursing roles, which has been really nice.
What's it been like to wear the PPE for such long periods of time?
It's very hot. You feel a bit claustrophobic. It probably takes me about 10-15 minutes to get used to being in the mask and all the kit once I'm in the room, just to sort of climatise. And then once you've got used to that, you sort of crack on. Try not to drink too much on your breaks, just in case you need a comfort break, and you don't want to take it off to use too much PPE that we know we're going to be short of soon.
I'm sure you're using eye contact a lot to communicate with the patients as well, because I think there's a lot of noise in these departments, isn't
Yes,
it?
yes, yeah. It's very noisy. With the masks and the visors over our faces, we have to talk louder. So to us, it seems like we're shouting, but so that we can be heard and that our colleagues can hear us. So hearing is slightly affected by that. Yeah.
Tremendous. In complete admiration of you. I think it's amazing. But alongside that, you've also been keeping your peritoneal mesothelioma service running, haven't you? What's that been?
Yeah. So the service at Basingstoke for the peritoneal mesothelioma patients is almost running as normal. So all of the clinics that we have had scheduled or are scheduling are being done by telephone clinics with the consultant. We've done a couple of video clinic calls as well, which has been very successful to be able to see those patients as well. Always not quite the same as being in the same room, but we're trying our best and it's appreciated. We've been doing our MDT meeting, that's our multidisciplinary team meeting for all the national referrals that we have to our centre. That's being done by a video conferencing call as well, so that we can all connect. It's well planned, so we can all see the CT scans and all the histology is reviewed by our pathologist, and that's all available to us before the meeting. So that's still working as normal. A lot of people are working from home, so we've all got IT access, and that's been able to allow for this working, and the hospital were very quick at sorting that out for a lot of the admin staff. So we're still open. We're open for referrals to our centre, and we're aiming to resume our surgery shortly.
I think that's become a concern to us, hasn't it, that people aren't presenting with symptoms via their GP or via hospital appointments, A&E departments. I know as a whole of us that we're concerned about that and the way forward, and how we urge people to let them know that there's still the normal health service going on.
Absolutely, yeah. So the GPs are still there. They still want to talk to us on the phone, or they might have online services where you submit your concerns. They're still there. We're still there. We're still working. So don't ignore any symptoms that you have. Please seek advice, because we're still here to be able to look into these things.
How are you continuing to support patients with mesothelioma and indeed their families?
So I'm still accessible. I'm on the phone, I'm on email. Patients and their relatives or families or carers or friends can still contact me, and I will get back to them if they don't get through straight away. Another option is to go onto the Facebook group that we have, Peritoneal Mesothelioma, where patients can reach out to others who may have been similar experiences and seek some advice or some support from them, or just friendly chats really. And I guess what's quite important to say is that if you don't have a key worker or a nurse at your local hospital, then we are here to be able to support you and to help you. So reach out to us, call us via the information line, and someone will be able to talk to you.
That's good. I think we appreciate that people won't have a mesothelioma nurse, and so they will be searching for information, and your last point is absolutely vital. So we would urge anybody to get in contact with us with any questions at all, and they can do that by looking on the website at www.mesothelioma.uk.com, or emailing at info@mesothelioma.uk.com, or using our free phone call number, which is 0800 169 2409. And we urge anybody with any queries to get in touch with us so we can deal with their concerns or questions. Sam, been brilliant to talk to you today. I'm very, very grateful for you linking in with me today. Please stay safe in both roles, and I look forward to seeing you very, very soon.
And to you, Lorraine, nice to talk to you. Thank you. Take care.
And you. Bye bye.
Bye bye.